Welcome back to Morning Line, everyone. Nick Barris here, Clint Kelly, malpractice attorney, taking your phone calls, 737-7587. People want to talk to you.
I'm glad.
No, he's a nice guy. You know. Anyway, the phone lines are open if you want to jump in. We're going till 9 o'clock. Questions, comments. We've already had a few calls with people inquiring about possible cases they may have, and they'll check with your office later. So, and we'll have the number up for Clint and how you can contact him later. Let's go next to Beverly. Beverly, good morning.
Good morning.
Hello, Beverly. How can we help you?
Okay, now this is more of a comment because my sister-in-law that passed away a few years ago, she fell at a facility, a nursing home, which I won't name, where they went to the hospital. Yes, she was sick anyway and was not expected to live long. I had to force them to make her go to the medical examiner because it was their fault. They left her on the commode by herself when she was very sick herself. And the doctors did not want to release her to the medical examiner. They wanted to release her to the funeral home. And my comment is, it is a law that if they fall in the facility, they have to go to the medical examiner. And yes, they had a case and won it. But I was just wondering if he knew that a lot of these doctors do not want to fool with a medical examiner. They want to go on and release them to the funeral home.
Yeah. Okay. Beverly's right. And it happens in a number of different contexts where a medical examiner or an autopsy is bypassed because of the concern of what the autopsy would reveal.
Sure.
There are occasions also where the medical examiner's office may decide that the patient's cause of death doesn't meet their criteria for an autopsy. But an autopsy is so important, Nick, because it reveals so much about the cause of death. And cause of death is something you don't want to debate in a medical negligence case. If you think someone has died from medical neglect or nursing home neglect, you don't want to be in a position where you have to prove that they actually did it or that the patient died from the condition that's alleged. Like, for example, a heart attack. If somebody dies from a heart attack, you want to have an autopsy say it was a big giant clot in their lower anterior descending artery to be able to prove that that was the cause of death.
Okay.
So the long answer to Beverly's question is yes, this does happen, and it's up to the family to make sure that the patient gets the autopsy so that there can be a definitive cause of death.
See, that's what's interesting to me. I wonder, I mean, we all go to doctors, and inherently we give them trust, okay? And most doctors are fine, okay? But if there's something that's going on, and from your perspective, are they always forthcoming to tell you if something went wrong, or how do you know and how do you hold them to it? If you have a loved one and the doctor comes in, well, this is what happened, and that's their story. Now, I'm not saying they're necessarily lying, but they're not telling you everything. How do you know?
Well, you don't. You do have to trust your doctors and make sure that in your own mind you think you're getting the straight story. There is, I think, in every person a sense, an antenna, if you will,
that something's not right.
That something's not right. You can detect it, and when you do, that's when you go the next step and try to find somebody who can investigate or get another opinion from someone else. And the answer to your question about trust is, we always hear of the cases where people have had their trust breached.
Right.
The vast majority of doctors are very trustworthy and loyal. The vast majority of lawyers are good lawyers, good professionals. We always hear about the bad ones because they're the cases that come to us.
Right. All right. So I guess just get to know your doctor, trust them, do the best you can, but always ask questions.
Absolutely. And if you have a suspicion, and that suspicion has not been remedied by what the doctor tells you, then you go get another opinion from somebody else or get investigated.
All right, phone line's open, 737-7587. See what Bob has on mind. Bob, good morning.
Good morning. Rosie, it's a good program. I had recently gone through chemo and radiation, and they put a port in. And my only concern, I had to fuss at them, how long they're going to keep it in. They finally put in a protocol of come in every 6 weeks and they clean it. But I just haven't heard from them how long they're going to keep it in, stuff like that. I might call the young lawyer there.
Have you had any infections or anything like that, Bob?
No, but that's what I'm concerned about, sepsis or...
Yeah, just as it goes. All right, so it doesn't sound like it's gotten bad for him yet, but he's kind of worried about it.
Well, you keep fussing, Bob, because fussing a lot of times will get you the care that you deserve, or fussing can prevent you from having a bad outcome that you otherwise would have. There are people who have these, I call them PICC lines, but they're central lines by which they get medicine because it's far more convenient and more effective than, say, an IV or taking medication through your mouth. But it is a breeding ground for infection and potential bleeding complications. And so you have to make sure that, and when I say you, I mean the doctors and nurses have to make sure that they do their job to make sure that it's positioned right, make sure that the infection risk is minimized. And if the patient thinks that's not happening, to do just what Bob said, fuss, to make sure that happens.
You know, since you've been coming on this show, the one thing now, I mean, I have a fear of going to the hospitals. All right, now I know when I'm sick, I'm going to want to go, and I understand that that's where you have to go if it's really bad. And the hospitals are jam-packed. Right. Every time I'm over there for a story, Clint, I mean, there are people on stretchers sometimes in hallways, okay? Right. I mean, they're triaging, and there's so many sick people. But from talking to you, the biggest thing I've got concerned about is you go in there now, and the infection. Infection.
Yeah,
I don't care what you go in for, you're asking for trouble just by going in there.
Well, sure. I mean, it's teeming with bacteria.
I don't want to visit patients.
Right.
Well, what do you do?
Well, I try to stay out of the hospital myself unless it's life or death.
And then will you wear a mask when you go in?
Well, you try to keep your hands clean. You hope that the healthcare providers have washed their hands and are keeping their hands clean. There is obviously some risk. I mean, you go there and you're opening your body up to all types of microorganisms in the hope that the health care that's provided to you will solve the problem and you can get out of there without some type of deadly infection. But the truth of it is that when you go there, these risks are getting worse and worse. And so, I mean, I tell people, just if you can avoid going, do so.
Right.
Don't take that risk unless you absolutely have to, unless a doctor says, hey, you need to go to the hospital. That's when you go.
Okay.
Or if you're in a life and death situation, you need to get in an ambulance. But just going in there for some things that I think sometimes people go to the hospital and don't really need to. And they're exposing themselves to a risk of infection every time they go.
And you're saying even if you're not being cut on, just being in there.
Right.
And, okay, and we should clarify on this. All right, hospitals, it doesn't mean that you're walking in there and it's a filthy mess. Of course, a lot of these microbes are microscopic. You can't see where they are. But, I mean, sick people go there, so there's going to be germs there. But you're saying, though, that there are some hospitals cleaner than others.
Oh, no question about that.
Just that they pay attention more to what?
They're just better. They're better. They're more. They're cleaner places than others.
And how, I always ask you this, and I know you, which is nice, but I mean, how do you know which hospitals are the clean ones?
Well, I know from my experience, so that's how I know.
Okay.
But you're not going to go to some website or some data bank that will tell you that. It's one of those things you have to learn from experience, sometimes by word of mouth, but even that's not going to be as good because most people don't have the knowledge that I have.
Right. Ah, jeez. All right, let's go to Jack. Jack, good morning.
Morning.
Hello, Jack. How can we help you?
Okay, 2012 I had open heart surgery down here at St. January Heart. I got out and come home and got to listen to the TV on the New England compound stuff, killing people on the sign. And I called them up to ask them to see if they had done anything about when they knew they had put some stuff in me to stop my heart to work on my arteries. And they told me no down there. And then about 2 months later, I got papers in my box here that said they did. So I'm having all kinds of trouble with my hands, my fingers. When I got back together, it was hard to heal back together. I think it had something to do with that. But they wanted to blame it on diabetes because I had diabetes before I went in. So I went to Lawrence Cass, was my surgeon down there, and he just I'd have to put up with it the rest of my life. I don't know whether there's anything to be done about it or not. I went to the lawyer with the paper, and they didn't want to do nothing about it.
Huh.
You know, I'm not familiar with Jack's situation. I'm familiar with the compounds that were injected into patients' spines.
Spinal stuff, right?
Yeah, it was steroid injections, epidural steroid injections to prevent or to reduce back pain, and those people got meningitis.
Right.
Those cases I'm very aware of. I'm not aware of compounds that are injected during some type of heart procedure. So, I mean, he may have a claim. I don't know. But I've not heard of that being a problem.
Okay. Well, I mean, it sounds like he talked to an attorney about something like. Also, that happened back in 2012, so I don't know if statute of limitations would be an issue, unless he got that notification that he received those compounds later.
But that is key. Is when Jack got notified, when he got that letter in the mail, I think that the year would start running at that point, because he would obviously be put on notice that something may have gone wrong.
Jack, that's something you can call and check with Clint's office if you want to see. I do. It's interesting that he brought that up, because I remember that was a horrible, horrible situation.
It was.
With the compounding, it was that they didn't have the proper cleanliness where they were compounding and making these materials, right, that would be used, as you said, to inject into spinal cords.
Yeah,
and some people died, I think. I mean, very sick.
They did, and some of them wound up in wheelchairs. The compounding pharmacies fall in the cracks, if you will, between regular pharmacies that we think of that are regulated and carefully watched, and these compound pharmacies would have their own standards that had nothing to do with government oversight, and they just kind of went about their business. People weren't watching to see what happened, and then boom, this thing happens.
And by the way, compounding pharmacies, what that means is they're the ones that get some of these drugs, and they're mixing, right?
Correct.
And making a compound for a specific need.
You remember those cases we had against the sex clinics, where the people had bad injuries from these compounds. That's what they do, is they buy the medicines injected into the penis.
Yes.
That is a compound made by a compounding pharmacy, and there are compounding pharmacies all over the country. You can buy compounds from Las Vegas, New England, wherever. Sometimes it's difficult to trace who does the compounding, but it's a very common thing to compound specific drugs to make another drug.
Okay, and so I don't know if since then, I think they probably cracked down on regulations.
No, they did.
to make sure that they're done properly and all those things. But you still involved with some class action cases?
Mass torts is what we call
mass torts. Okay.
Yeah.
What are the biggies right now?
Xarelto is still really.
What is that one? What does that do?
It's a blood thinner. The big problem with Xarelto is at the time that they were marketing and selling it, during the time that my clients got injured, there was a bleeding risk that was not properly disclosed to the patients. And if you start bleeding on Xarelto, you can't stop it. There's no antidote for it. And so some people had major bleeds and died. Others had major bleeds, wound up in the hospital for 3 or 4 days trying to get blood transfusions. The drug makers since corrected that problem by warning people about the bleeding risk, and I think now they actually have a means to try to arrest the bleeding episode, but at the time that my clients were injured, that didn't exist.
Nothing like that.
Right.
All right, on that note, we'll take a break. Come back. More of your calls. Phone lines open, 737-7587. Final segment with Clint Kelly right after this.